Good afternoon, everybody. It's Mellissa Thomas and, of course, Angel Perry, who is the Executive Vice President of the Communications Workers of America, Local 3108. Welcome to another episode of hashtag Let's Clarify, guys. Thanks so much for tuning in. Angel, how's it going?
It is going. How are you, Mellissa?
Doing good, doing good. Always good to have you. Always good to have you. So today we want to talk about something very top of mind. We want to talk about medical professionals wasting the COVID-19 vaccine. Now, mind you, spoiling it. So you guys probably heard the story already because this actually goes back a couple of months. But given the current push for an increase in demand for the vaccine, we felt it was kind of important to kind of go back to this story and kind of pull it apart a little bit and talk about what happened there, and then kind of apply it to what's going on now and the possibility. I mean, this is still a thing. Like, given the increase in demand, this could very well still happen again. So yeah, Angel, go ahead. Let's kick it off.
So we have Stephen Brandenburg, 46. He's facing up to 10 years in prison. What he decided to do, December 26th, in Wisconsin, he took a box of Moderna COVID-19 vaccine, 570 doses, and left them out to rot. So as everybody's heard across the news, that it has to be specially regulated in refrigeration in order to stay good. And then once the box is unsealed, it has to be used same day. You can't refrigerate it. So what he decided to do was just leave it out under the guise that, it's not good for you. Bruh, just, walk away. Like, if it's not good for you, sir, then you could have just, I quit my job. But he didn't do that. He destroyed private property. And he's supposed to be a professional.
Essentially.
And you got to wonder, like, how many of these people that have these degree educations in the medical field are going around spoiling the doses?
Right. And I think the report said it was 570 doses of the vaccine. And then there was some 57, so 10% of the people that received that lot, like out of that lot of spoiled vaccine, like they got it. So there was an investigation to check whether or not those doses were effective at all, or if there were any reactions.
Right, exactly. So, that guy, he took his personal beliefs and decided to force it on people.
That part.
That going on.
That part. So, I mean, folks, leave your comments below, man. We would love to get your thoughts on this, because if Angel and I are trying to figure this part out, like being a medical professional and then being an anti-vaxxer, that's quite a dichotomy. And then for his part, he believed that the COVID-19 vaccine, we'll say it in general, he believed that it alters your DNA. So he didn't want the vaccine to reach people. Now, obviously, that is not the Moderna one. The Moderna one was not the one that claimed to do that.
No.
And the FDA approved it. They proved that it wasn't a vaccine that would alter your DNA. So he kind of had his information wrong.
Himself in Wisconsin, that never mind what everybody else is doing or saying, I'm going to do this with this box. That sounds a little, extra. He was being extra.
Just a little bit. And actually, he had left it out twice. So he had pulled it out on the 24th.
12-hour increments, 12-hour chunks of time.
Yeah. Pulled it out, left it out, and then put it back in the fridge, and then pulled it back out on Christmas Day and left it out. So I thought that was very interesting. Now, for something like this, though, Angel, what course of action would people be able to take if they come across a story like this, if they hear some through the grapevine, if they see something, like what would their course of action be?
So they want to immediately contact their Department of Health, because the thing is, it's a medical malpractice, no matter what medical professional is doing that. Now, if your personal beliefs is against the vaccine, so be it. That is you and for your family to decide, but you can't make that decision for other people. You can't claim freedom and then want to take everybody else's. Like that's just not how this country works. So he's under prosecution right now, facing 10 years for destruction of property, and it's just ridiculous. Like, stay home, bro. Stay home.
I'm saying.
If you don't believe in it, stay home. Like, nobody's making you show up. Find another. Well, now he ain't got no job. He going to jail. So
for a decade. For a solid decade. For a solid decade.
He going to jail. That's what he wanted.
Do not pass go. Do not collect $200. Okay.
Let's get dumb prizes. Okay.
You know what I mean? So we're going to take a quick commercial break and we're going to come back. We're still going to keep the conversation going about vaccines and their importance. But now we're going to, in the second segment, we're going to move the conversation to the state of Florida specifically, and kind of this back and forth we're seeing with our own governor, Governor Ron DeSantis. Yeah, exactly. So we will be right back, guys. Stay tuned. And again, leave a comment below. Let us know your thoughts on the first segment and the gentleman who decided he was trying to rescue everybody from something that wasn't going to happen. Let us know your thoughts on that. We'll be right back.
At Duke Energy, we deliver electricity and so much more, like free home energy assessments, rebates for energy-saving improvements, payment options to help you better manage your budget, and even bill credits for helping the community use less energy. So no matter what you're doing, we can help you make better energy choices every day. It's just another way we bring power to your life. How much can you save?
All right, guys, welcome back to Let's Clarify. This is episode 6, by the way, so huge congrats, Angel, episode 6. I'm keeping it going. but just to jump into, the conversation about what's going on here in the state of Florida, obviously, there's been a bit of blowback with Governor Ron DeSantis. Folks are saying like he kind of prioritized the wealthier communities first. So kind of let's clarify that. Let's get into the details of that.
So I'm trying to find the connection. So my understanding is that early on, before Publix and all the other distribution centers got their contracts for the vaccines, as they were rolling out, apparently either the wealthier zip codes like Lakewood Ranch, which is 34202, the average home valued is, over $500,000. So if they are able to buy the vaccine before it was mass distributed, that could be the story. I don't see anything specifically that says, okay, well, the governor did this on purpose. Now, what couples on top of that, all the states have, and we talked about it earlier, you reminded me, there are food deserts. So once all the distribution centers had their contracts and had access, so we have 67 counties altogether in the state of Florida, and 52 counties all have pharmacy locations. There's 490 of them. Walmart, Publix, Winn-Dixie, Harvey's, Fresco y Mas, and Sam's Club all have access to the vaccine now. So if you go to the Florida Health COVID-19.gov, you can actually click on vaccine locator and find your county and then find what locations. But there are food deserts. There are places that are so poor that there are none of those locations, so there's no vaccines available.
Right.
So when you have the wealthier areas that are able to purchase the vaccine and distribute it at the beginning of the vaccines being available, and then you have additionally distribution through pharmacies and pharmacies. Basically, all these supermarkets have pharmacies in them.
Right.
What about the neighborhoods that don't have these places? And that's the question. And that's going to be always the question. How is the state of Florida or all the 50 states handling their food deserts? That's always been the biggest cry of injustice, is that we're finding that the places that have the least amount of money circulating, the struggling areas, because it's, you know, no stores there, no banks there. And then you have those that, know the history of a lot of these states that did redlining. For those that really want to pay attention to what that is, COVID-19 has highlighted specifically that businesses just didn't go in certain areas on purpose. So now you have people that are in these redlined areas that, one, when COVID hit, the infection rate was almost double than anywhere else because, one, there was no access to education of what was going on. There's no access to food. They don't have fresh fruit. All of these things that contribute to the higher death rate. So all the governors were asking, what are you doing about your food deserts?
Right. Exactly. And I mean, some folks in Tampa were, trying to ask the governor about that. And the governor was just like, hey, if y'all don't want it, I know where to send them. You know what I mean? Like, that was essentially his answer. Like, whoever wants them, I'm making sure they get it. So and then that was a big pushback.
Right. And then that's where the really sit down, uncomfortable conversation has to take place with legislators. So for those areas that have food deserts, you have House and Senate representatives, not just the mayors. The towns might be so small, the mayors are overwhelmed too. You got, they go to the next town over to go to the hospital, or they got to go miles and miles to even go to Publix. I was listening to the radio the other day, and one town was so small, they only had one McDonald's, and you had to take a drive to get there. So,
wow.
I mean, it's unfortunate that, these businesses that years ago, they'd be like, oh, we don't like these certain people, we're not going to do business there. And then we're in 2021, and the after effects, the ripple effects, that stone thrown in the lake is now turned into a tsunami under COVID.
Yeah. Like, COVID exposed a lot of the cracks in the structure, economically and health-wise, in terms of healthcare. Socioeconomically, going to what we're talking about in terms of the food deserts.
Right.
And, we were talking before the show began in terms of what the workaround is. And as you mentioned, the key is going to be with the state legislators, because we're seeing that even here locally now. We're starting to see that, for example, State Representative Daisy Morales just did vaccination events, 2 of them now. There was one on Saturday, and then she did one again today. And
really? Wow, I didn't know about that one.
Yeah, she did one again today. And the key that we're seeing, at least here in Florida, perhaps across the country, is places of worship teaming up with legislators to become locations for vaccination sites. Since a lot of the communities, particularly the ones with food deserts, they don't have a lot of big supermarkets, but they have a whole lot of worship centers.
Correct.
A whole lot of churches. So
Yep.
That's been the workaround so far that we're seeing. And Representative Morales like broke the news media this morning. Especially last night, she had sent a letter to Governor Ron DeSantis pushing for a 24-hour vaccination site.
Right.
So that would be. So, I mean, that concept, and that's not new for viewers. If you're hearing this, that's not a new concept technically. There was a site in Philadelphia. They were able to do that at Temple University. It was literally only 24 hours. They did it for just one day, but they were able to vaccinate roughly 4,000 people in that one day. So in terms of, answering that question as like, okay, we do have the food deserts, but what is that solution? We may see more of that. It might be connecting with the worship centers. And hey, this goes back to what Angel is always telling y'all: harass your local elected officials, call them, Google them, research them.
Right. That's what they're there for. I mean, we chose them to be our voices. And sometimes they don't know that there's a need somewhere, and they don't know because we're not telling them. So make sure you're registered to vote. Make sure you're Googling who your legislative representations are, whether it's state or federal level. And when there's a need, you email them. Make it sure that it is a record. Because sometimes, even just the phone calls isn't enough. But sending an email to your legislator is a public record in most states. So they don't want to be seen as, I need help. There's no vaccine centers where I live. I don't have a car. Whatever the scenario is, and you're trying to get help, reach out to them and make them do their job that they said they were going to do.
Precisely.
Accountability. Okay.
And for our viewers, this is still very much connected to what we talked about in the first segment in terms of vaccine waste. Because, of course, if there is a situation where they have a box of the vaccine, once it's open, they have to use it, right? And if there's not enough of the folks that registered for appointments that fall within that 65 and over criteria, what ends up happening to the vaccine at that point?
So it's called spoilage. The CDC is already estimated 0.02% up to 0.2 amount of the vaccine going to waste. But across the country, for some places, if people aren't filling their appointments and say they're at the end of the day, there are some places that if you wait and you fit the criteria, you can get a vaccine anyway. So, I mean, there's no guarantees, but CDC guidelines say they have to administer the dosage. So, if you're having a hard time getting an appointment, I don't recommend waiting to the end of the day, but if you're getting that desperate and you're not able to travel and it's too far, I would speak to the manager of that facility and just say, listen, I've been trying to get an appointment, can I pick a day that I would be there? And I know it's like waiting for that, golden ticket at the airline, because we've all done that. We're at the airport and I'm like, oh, I need this flight. And well, we don't know if there's enough seats. It's going to be in that kind of respect. So you just want to partner with the managers of those facilities and see if there's, I'm a pick Wednesday and, I know there's no guarantee I can get one, but, just in case there's extra at the end, I will be here. Here's my number. Here's my information. Here's my ID. So, I qualify. And that I am a resident, because there's all those rumors.
Yeah, important. And that's actually the perfect note to go out on in terms of a commercial break. Because when we come back, we're gonna talk about them crazy ladies.
2 women
who was trying to bogart a vaccine.
Yeah, we thought everything.
We're gonna talk about it. We'll be right back, you guys. Stay tuned.
I'm not picking it up. You pick it up.
I'm not picking it up.
Well, somebody's got to pick it up.
pick it up. They're clean. 'Cause my hiney's clean. Oh yeah, I'm Charmin clean. That's how I know they're clean.
Charmin Ultra Strong is woven like a washcloth and just cleans better.
Yeah, I'm Charmin
The
clean.
kid does have a
That's
point.
My hiney's clean.
Enjoy the go with Charmin. And for an extra clean finish, try Charmin Flushable Wipes.
All right, y'all, and we are back with Let's Clarify. Talk about two ladies whose heinies were not clean because they were trying to lie to get that vaccine.
They were
They were trying to lie to get that vaccine. It was a problem. It was a problem.
Wannabe grannies, they were ID'd as Olga Monroy Ramirez and Martha Monroy, so they were sisters.
Sounds like sisters. Mm-hmm.
They were doing a scheme, and this is what's been sporadically happening across the country is when people were setting up appointments, those privileged folks that don't think, waiting their turn is enough. It's about me and I got to have mine. They would set up the first appointment. So they already had their appointment. And this was what was happening.
Mm-hmm.
When those first doses were given out, you have to set up with your birthday and your ID and all that stuff. People were forgetting the birthday that they put in.
Oops.
And with these ladies, I mean, their makeup and wigs and whatever they had going on was
glasses, all that
was so bad that the shot person, the person administering the vaccine, was like, "Wait a minute." Now, they weren't arrested or anything. They were just trespassed off the property because they were just trying to save their own skin.
Dr. Pino was like, sorry, y'all.
We
can't do it. Can't do it.
Bye. Just go.
Exactly. He had actually talked about it during the press conference. Yeah, like the following press conference that he had, he was like, yeah, you have to provide your actual honest date of birth, guys. Like you can't you can't be trying to deceive the folks.
Would have got away with it too if it wasn't for those darn kids.
I know, right? Scooby Dooby Doo. Those meddling kids. Man,
that was a actual who's under that wig? Like what?
Exactly. But now, is there something that people can do on that note? Because obviously we have the course of action for if we see medical professionals doing something sketchy, and it makes sense, that course of action, if we see something, say something. But when it's a fellow like resident or like a fellow layperson,
I mean, just letting one of the administrators know, there's this strange bunch over here. That's all. Just be like, excuse me, there's, I think this person is not actually old.
you know what I'm saying?
They look like they're in their 20s. I'm not sure about this. They're not 65. There's no way.
Yeah. Like no amount of oil of Olay is gonna.
No.
You know what I mean?
Yeah, those two women just were having too much fun. So.
Wow. But to answer you guys' question though, if you have questions about registering for the vaccine, make sure to do your homework in your respective area, wherever you are. Whatever state, whatever county, because
Department of Health.
Mm-hmm.
We'll have the link for your COVID vaccines in your state. Or here in Florida, it's going to be floridahealthcovid19.gov. And you're going to click on vaccine locator. You find your county, and then it'll tell you what places have the vaccine, and then you schedule your appointment. Now, you really do need to be on that website at least by 7 or 8 a.m., sometimes slightly before, because the appointments fill up really quick. So,
and then run that website one more time.
FloridaHealthCovid19.gov, and then click on Vaccine Locator.
Vaccine Locator, guys. Make sure you do your homework on that. Make sure you do your homework on that. And of course, Google is free. We always tell y'all that. Google is free. Google is free. And, you know, as Angel mentioned in the first segment, if you spot a medical professional being reckless or wasteful with the vaccine, make sure you contact somebody on that. Like, make
Yeah, you
sure.
want to immediately reach out to the Department of Health in your state.
For sure. And again, if you see residents on their Scooby-Doo, like, just talk to the on-site manager. Talk to the on-site managers. Yeah, usually members of the National Guard or members from the Division of Emergency Management. At least, you know, here in the state of Florida, those are your two personnel that you can talk to that are on site, administering the vaccine, kind of waving people through, moderating traffic. Talk to one of those guys to make sure that things are going smoothly. And by the way, don't you be that Scooby-Doo perpetrator. Keep it honest. Keep it honest.
Yes,
if you're not 65 and over, if you're not a first responder, because they're the ones that are up next. First responders and teachers, I believe, if I have that correct, they're in phase 2.
After that, yes.
Okay. So if you don't fall within one of those groups and you're like last bus, it's okay. Like, we're coming. We're coming. The rest of us are coming. Just be patient. And as we can see from a lot of the statistics, the COVID-19 vaccine is helping because the numbers are starting to go down in terms of the number of deaths we're seeing. Unfortunately, we did hit that 500,000 mark in terms of COVID-19 deaths in the US, but the number of deaths are starting to decrease per day due to the COVID-19 vaccine. The number of hospitalizations decreasing due to the vaccine. So it's okay. Be patient.
We talked about the last segment.
Absolutely. Absolutely. Any final words?
Well, stay safe. That's it. Oh, well, we got Sputnik V that Russia is doing. They have actually several countries that got orders, including Mexico. And then we have Johnson & Johnson, which is going to be getting their emergency use review on this Friday. So you want to check your local news about that. The Johnson & Johnson shot is a little bit different than the Moderna and the Pfizer, in which case it's a 1 dose. Instead of having to do 2 doses, approximately 10 days apart, Johnson & Johnson is a 1 dose vaccine. And from what the FDA says, everything looks really good. So, yeah, there's a lot of good stuff coming down. We're getting, there's a light at the end of the tunnel and we can see it.
Yes.
There.
Yes. And thankfully, it is not a train. It's all good. Like, it is literally a light at the end of the tunnel. So definitely, guys, stay safe. Thank you, as always, for tuning in to Let's Clarify. And as you see on the screen, use that hashtag when you're leaving your comments, when you're sharing the video. Go ahead and use that hashtag Let's Clarify. And hey, if you guys have topics that you want us to clarify, of course, leave that in the comments as well. We welcome that. We would love to piece some things apart for you. You know what I'm saying? Break some stuff up. And of course, if you haven't yet, be sure to like, share, subscribe, follow, all that fun stuff. Now, our shows are going to now come through hashtag or at FNN News TV. All right. So used to be Florida National News, but FNN News TV is one of our homes as well. So you'll find us there. All of our socials are scrolling across on the bottom. Follow us on Instagram at Florida National News. Subscribe on YouTube at Florida National News. Make sure to click the little bell icon so you can get all the notifications for all of our shows. And of course, if you want to follow Angel on Instagram and add her, you can find her at A4Amazing. All right. She is there. Got she's ready to answer any questions you got. She does a weekly check-in, which is awesome. Just a nice radiant picture of her. And she's like, how y'all doing? Let me know how you doing. So be sure to hit her up on Facebook or Instagram. All right, guys. And of course, I'm Mellissa Thomas. Always a pleasure having you guys tune in. Always a pleasure having you on with us, Angel, excuse me. Angel, thank you so much. Appreciate you. No problem. You guys stay safe. All right. See you guys next Wednesday. Take care.
Okay, get this light out my face. My eyes hurt.